Hey folks, we're back. I'm your host, BKP. It is now time for Ask the Doc with Dr. William Whaley, and we're here at Sycamore Crossing. I'm going to go on my phone because I do want to see the questions. But
I got them right here. You don't need to do that.
I know, but the laptop
There's
just
not
died.
there are not any words in here that you can't pronounce. I'll do them.
That's why I wanted to go, because it's not every week that I get...
You get to be able to speak all the words, right? While you're doing that, I'll say that the dress consultant, we do have, as you know, a green room back there where they put the makeup on and everything. They sent out a memo that it was springtime, so we were supposed to be in pink. You see the pink shirt here and the pink tie. I don't know whether the expert panel got the pink memo or not.
We'll see when they get there. I don't have the questions, but
all right.
How are you doing? We're Sycamore Crossing.
Yeah, we're doing right here, man. This is beautiful, huh?
We're gonna. I don't remember.
I haven't seen the beer truck.
I was getting ready to say, do you know what time the beer delivery is? Not right here on the set, but I don't remember.
Usually about 8:30.
Is it about 8:30?
Yeah.
And then what time is our train whistle?
Well, train whistle's variable. And the guy that used to do the train whistle is not with the train right now. I mean, I just saw him in the office this week. I don't understand the politics of the train, but the guy who used to do the train whistle in the morning at 8:10, it was 8:10 or 8:15, I know for a fact that he right now is not working with the train. He's got something going on in his family, and a lot of that train is volunteers, so we don't know whether the new volunteer has the message to run the whistle or not. I don't know.
We better have the whistle. That's the whole, I mean, that just pulls everything together.
We could call him up and ask him.
Yes, we'll have to.
All right, I got another thing I got to tell you.
I know, let's get started.
All right, okay, now, this, I've printed off for one of your expert panels the requirements for a residency in Mexico.
Okay.
And there were about 100 and something pages, and I only printed off about 10. But you know that I've been on all 7 continents, and I've been to more countries than most anybody in the mountains up here have. And I know that to get into Switzerland, you have to build a business and the stuff. But if you just see the requirements, but the top one on the list to be able to get into Mexico is you have to be economically productive for the Mexican economy.
Right.
You have to have resources, and you have to apply to an embassy not in the country. So you've got to go to the embassy in your own country to get into Mexico. Now, I'm going to stop right there, because when I looked at that...
So you got to go, if you're here, you got to go to the embassy here.
Yes.
You have to make sure that you're going to be a productive citizen.
Yes.
And you're not going to come in and take their resources.
Correct.
For any, you do not need economic support from them when you get there, right?
No, that's correct. And then
Okay.
one of the other things is if you're going in there and start a business, then you get a little bit of a leg up. But anyhow, so when I saw that come out yesterday, I know you'll have a topic of conversation. Probably you'll be talking about the Kardashians or something, but I think immigration's, that was a joke, by the way.
I got it.
A little more important. All right, so I just killed another chigger. I just love being outdoors in the South, man.
All right. Let's start. We want to thank Georgia Cancer Research, affiliated with Northside Hospital. Georgia Cancer Specialist, affiliated with Northside Hospital Cancer Research Center. Let's get started.
Let me stop you right there a minute. Just this past week, the Northside Hospital Cancer Center was ranked as one of the top 2 in the nation. I think you might have seen that in the Atlanta newspapers last week. So top 2 in the nation is pretty good for community cancer centers. All right, go ahead.
What are the symptoms of fatigue associated with cancer? And when I read this question and I was going over it, I thought I like this question almost in 3 years, because what is associated with cancer and what are some of the warning signs and fatigue? So what are some of the symptoms of fatigue associated with cancer?
Okay, well, I can ask our production supervisor what is fatigue?
What is fatigue?
Yeah.
Feeling of being tired.
Well, no, put that first one up there.
The feeling of being tired.
All right, see, that's...
Where's my buzzer?
You won't get it. All right.
Or
I
get
know
that
you're not
big,
wearing-
there you go.
I know you're not wearing your glasses, but
They're upstairs.
all right, they're upstairs. But this is just the components of a breathing. I really think it's a great question because fatigue is in the mind of the beholder. It's a whole lot like a good, happiness is in the mind of the beholder. Pain you can't measure, can you? Somebody says, oh, I'm in pain. You can't measure. Fatigue really is very difficult to put your hands around, put your arms around. So this is what's considered a fatigue inventory, whether it's cancer or anything else. And it begins by saying throughout our lives, everybody has felt tired or fatigued. And then this asks, first of all, have you felt tired or fatigued within a week? And then give your fatigue a number. 0 is not much and 10 is I'm really bad fatigued. But then what aspects of your life is this affecting? You'll notice a lot of this is emotional. Enjoyment, relationships, mood. So of the 6 measures, 3 of them are sort of psychological, aren't they? Then the other one would be walking ability. That's objective fatigue. Normal work, in other words, I can't lift up my 2x4 or drive a nail if you're in the construction business. And the other one's general activity. So that's basically sort of the category of what is the universe that fatigue is in. So pop up that next one, which I know nobody's ever going to be able to see, but this is a 3-page list of just symptoms that distinguish chronic fatigue from various medical illnesses.
Okay.
Chronic fatigue from rheumatoid arthritis with fatigue or low thyroid with fatigue that's not associated with some medical illness. This, by the way, is a 3.5-page list. I just put it up there so that everybody could see how complicated it is. But at the top, you've got things like fatigue that's associated with muscle discomfort. The second one, you've got fatigue, and what's the duration? 6 months of fatigue, 3 months of fatigue, a day of fatigue. Do you have fever? Pull that one down. All right, we're getting ready to focus now just on cancer. Look at this thing here. That is 3 blinking pages long, and I hope the people can read at the top. It says the American Society of Clinical Oncology Guidelines for Treatment and Care of Fatigue in Adult Cancer Patients. Now, if you just look carefully here, and again we're looking at categories.
Sorry, Dr. Whaley, I don't want to interrupt over there, but we're now at Sycamore Crossing. We have to watch our back. The All-Star panel showing up.
Sleeking up in here.
All right. Be careful.
Okay. You'll first of all you'll see again that this is a lot. It divides the fatigue definition into physical activity. There's only 3 lines of the physical activity. Psychosocial.
Right.
Mind, body.
Yes.
And the effects of the pharmacology of the treatment of cancer. Okay. So that's 2 or 3 big old pages. So now let's get to the things people can see, all right?
Cancer-related fatigue.
Yeah, I didn't want to confuse everybody, but when you say cancer-related fatigue, it sounds really simple.
Yes.
Those last 3 things nobody can read anything about. Tells you that it ain't no easy question. There's not an easy definition, and there are lots of things that relate to cancer-related fatigue. If you stay to the left-hand side, you've got emotional issues. You've got difficulty with sleep. Flip over to the other side where you've got things like poor nutrition and so forth. And then at the bottom, you've got a whole list of things that can be occurring in cancer patients that aren't related to cancer at all. Like they may have an infection, they may have lung infection, their kidneys may not be doing too good. So there is no real the question was, what are the symptoms of fatigue associated with cancer? That was the question. So the answer is there's no really good answer. There are so many components to the person's perception that I am fatigued that the American Society of Clinical Oncology has a 3-page laundry list of trying to dissect out whether that is a mood disturbance, whether it's my fatigue is a get up and go issue, or whether it is objective. My job is as a carpenter, and I usually can put up 10 2x4s in an hour or something, and now I can only put up 6, meaning an activity diminution or physical diminution. Then what kind of things would the cancer treatment or the cancer itself have affected? So when you get into there, I've mentioned once before that we frequently note that women who are taking cancer chemotherapy, they C7 menstrual cycles, it adversely affects the testosterone of men. So we would try to isolate those and then fix it. Give the guy a testosterone shot, give the woman a hormone or whatever. And if this is a depressive thing and is related to mood or getting along with the family or whatever, put them on an antidepressant. I think a few weeks ago when we were talking about depression, I said that if you take cancer patients and give half of them a purple placebo and the other half a antidepressant, those that get the antidepressant have a quality of life paper they fill out over years that's somewhat better than those that don't have it. So I wish that I could give you the symptoms of fatigue associated with cancer are that you can't walk across the room as fast as you did, or you whatever it is, but it's just it cannot be answered in that fashion. Let's go to the last one there, because we're going to talk a little bit here about the interventions. So you got to watch this now.
All right.
So what they're doing is they're getting all those complicated pages and trying to bring it down to something simple. All right. So if you get to the top, where the causes of we're going to make like everybody knows what the definition is now.
Right.
Now we're going to get into treating it, to treating how you've got it. So if it's due to poor nutrition, it's a nutritional issue. If it's due to your blood count being low, it's to bring it up. If it's due to depression, you're going to take care of that. If it's due to the fact that they've been operated on and been in bed for a week, you're going to give them some physical therapy. Now the last one, that hypogonadism, is the testosterone and the estrogens. So that's the condition. But on the opposite side, you got what? Treat symptoms.
Yes.
Now we got drugs to wake you up in the morning. If it's a fatigue, you can't, your definition of fatigue is, I get out of the bed in the morning and I can't get started. Well, I'm not going to make you read it. I'm not going to read what methylphenidate is, but that's that, that we have drugs for that. If it's an appetite and a nutrition thing, we got drugs for that. And if it's simply poor performance, then here we've got physical therapy, we've got cognitive behavioral therapy, that's sort of psychological teaching, and then we've got other specific therapies. So I didn't want to make it too complicated, but it's semi-complicated. And that semi-complicated is we've got lots of ways to intervene upon the causes, lots of ways to intervene upon the symptoms, and that I hope that doesn't confuse you. Confuse you?
No, it didn't. No, it didn't confuse me. I mean, I will say this: I'm glad that we actually got into fatigue, because I think I don't know about out there, but for me, I didn't understand it in that depth and that wide range of what fatigue is. I mean, I would be like Josh. I think my first thought is tired. I'm tired, and that would be fatigue to me.
Hard to define.
And then when I look at mood, Josh, what a lot of people don't, when you're new and you just come on board, see, I come in the office, I get all worked up, okay? And what I tell you,
that's not fatigue.
No. When we had mood,
right,
I get all worked up, and I say, "Do you people not realize when I'm in a good mood? That's my good mood when I get."
Yeah,
I mean, I'm just joking. Sometimes I get all worked up, and I'm railing. Josh will tell you, and I say, "Do people not recognize when I'm in such a good mood?"
Let's go back to last Friday, okay?
Whoa. Okay.
All right. Last Friday, I know that you've got a memory disturbance, but last Friday, when we came in, you'd been on baseball till blinking midnight.
Oh, yeah. Oh, absolutely.
And your voice was bad, and I was trying to get you to whisper. But you weren't fatigued. You weren't fatigued. you were tired.
I get it.
You'd been working for what, 3 nights in a row till midnight. So there's a lot of difference between that and what people are talking about, pathological cancer-related fatigue. A lot of difference.
Again, we always want to thank the Georgia Cancer Research and Northside, affiliated with Northside Hospital. And again, Dr. Whaley said in the media this week around the Atlanta area, Northside Hospital number 2
in the nation.
In the nation. So we appreciate them for this segment. Our next question for Dr. Whaley is, I have 27-year-old female and I have had a brain tumor. Which was treated with radiation. Does radiation therapy cause hearing problems?
Well, it's a good question, but we have less definition there than we need. If this patient had had a real tiny tumor treated by radiosurgery, which is, that very intense thing that goes to the tumor, it would not affect hearing at all. Put up that first picture there. Since there's been so much John McCain and everybody else with brain tumors, I thought I'd take a real quick look at brain tumors here, since you're talking about a real complicated issue and you don't have enough in the question to be able to answer it. So you got that first one up there. Obviously brain tumors are something that has to be controlled locally, and you generally think about surgery. Radiosurgery, which is the second thing on the list here, is that focused, there goes our train.
Yes, I'm listening.
No whistle, it's the bell, so it must be a new volunteer. Okay, radiosurgery is that very focused, high-intensity radiation that really it can focus right down to the hundredths of a millimeter and doesn't affect the brain around it. It would not be expected to affect hearing unless it's on a part of the brain I'm going to show you in just a minute. Most brain tumors today, say John McCain and people like that, begin with surgery, and then the third over here is chemotherapy with radiotherapy. So this is McCain would have had an operation to remove the tumor, which can't remove all of it. And the analogy I made here on the air, I believe it was about a year ago, is you think about an astrocytoma like you've got a handful of pancake batter and you slap it on the wall. You're going to have a big blob in the center, but you're going to have these things that run out there like that just like. So you can take out that blob in the center, but you can't take out everything that ran out there, and that's why it recurs and why it kills people. So when you get to that point, then you give chemotherapy pills while you're doing radiation. The chemotherapy pills increase the sensitivity of the tumor to the radiation therapy. Now go to that next picture. Everybody who's had a real brain tumor operation looks like that. And if you'll look at the bottom end of that, where's that scar end?
That right here,
right in front of the ear.
Yes.
So go to the third one. This is the apparatus of the ear. We showed this a couple of weeks ago when we were talking about being dizzy, right? So if that surgery has got to there and there's tumor that's gotten that close and you're going to radiate that tumor, then yes, it's going to affect the hearing in that ear. Go to the last one because I want to show this. Now, you guys, I know you can see that computer, so I want you to get up and take a look at that computer.
Get up.
Get up.
I'm getting involved with it. Get
up. You're seeing a young woman there.
I am seeing a young woman.
You're seeing a woman there who is wearing on her head what looks like patches of aluminum foil that are hooked to electric wires.
Oh, I see that.
All right. Now, this technique is taking advantage of an experimental finding that was just discovered about 2 or 3 years ago. And that is this. If you took plates, now all these guys up here know about car batteries. If you just took a plate and put the positive on one side and the negative on the other side of a car battery and ran a direct current through the head of somebody with a brain tumor, it diminished the progression of that brain tumor, and people who had these electric currents pass through their brain lived almost twice as long as the ones who had had this other therapy that we've talked about. This is called Optune, Optune. Until 8 weeks ago, if you wanted to get this treatment in this area, you had to go to the Brain Tumor Institute at Duke. If you want to get this treatment today, you can come over here to Riverstone and I can give it to you, or my partner Jennifer Jones can give it to you, because this has been brought into the community cancer program within the last half a year or so. So now we go back to the original question. So the debulking surgery, if it gets down near the ear, the surgery can get the hearing. If that radiation therapy has to be near that vestibular apparatus in the ear, it can get that hearing. But if it didn't, and you use this, your hearing's going to be just fine. So how's that?
Oh, okay.
So you don't have to have your hearing. But radiation can diminish your hearing if the radiation is on the spot that the ear covers. Now I was going to show you the apple cider vinegar thing here.
Folks, can you ask the doc a question? Absolutely. And how you do that, you send an email to info, I-N-F-O, at fetchernews.com and put right in the subject line, ask the doc, and we'll get it to Dr. Whaley. Also, look us up on social media, Fetcher News, FYNTV.com, our Facebook social media page. We always put the Ask the Doc segment up there. You can put something on there and we will look over it, see if we find your question there. Also, again, thank you, Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment. Okay, it brings us to this point in time in the show.
Well, the funny part was when I walked in this morning, you said, I'm not going to ask you.
You tell everything, don't you?
I'm not going to ask you this question unless you say it's okay.
Well, I did. All right. Good.
I've been hearing that apple cider vinegar is good for your blood pressure and good for, what else was it? Blood pressure and stuff.
Belly fat.
Stuff. Oh, I fucked that one up.
I'm sorry.
Good for stuff. So I went on up to date, and there are 18 things listed in the valid medical literature for apple cider vinegar, sort of the grandmother used it for. And I mentioned one which you told me not to mention, but women have used apple cider vinegar historically.
Don't mention that.
I won't mention that one. But it's been used for...
And I didn't mean cleaning windows.
Yeah, but look at this one here. Tinea capitis. What is that?
I don't know.
That's scalp wet rashes and ringworm. And you know, we've had a lot of that. And so in terms of what your grandmother would have used that for. Now the other one here, oral allergy symptoms and pollen food allergies, actually using the apple cider vinegar for people who have some allergic components. There's enough stuff when you think about apple and that's in there that it can help a little bit diminish the allergies you would have to certain foods. And then it has been used as sort of a gargle and a rinse for various sorts of things within the mouth, and even as a flush for things within the ear. So I'm not going to, but it's not going to help your blood pressure. So there are valid things it's used for, primarily its local effects, okay? So I just didn't want you to feel like I was laughing at your apple cider vinegar for blood pressure, but it ain't going to help.
Is that it?
That's it, yeah.
Okay.
Hey, you want to go to the news?
Yes, I mean, they're waiting out there.
Okay, guys.
Give us a quick update on some things.
Okay, it's springtime.
Lyme disease.
Now
a threat in city parks.
Okay, it's Lyme season. Has anybody heard one thing about Zika? Not one thing in the last 24 months. So forget about Zika. We in this area up here now, we have a bunch of adults here, and I don't think any of these adults have any tattoo ink on them. But we have a lot of people in our listening audience who do have adolescents and young adults that are getting tattoos.
Absolutely.
There is a huge recall started yesterday all over the United States that tattoo inks are contaminated with bacteria that are the E. coli and MRSA type, and you can get a really bad infection, and there's no real indication which one it is. And so that's another reason I'd tell your kids to stay out of the tattoo parlors. Right this minute, there's a big-time epidemic of infected tattoo ink. And lastly, we always talk about the vitamins and supplements, and I say it's mostly junk. Well, CVS has just started testing all of theirs, and they find a very high proportion of the ones that they're selling, and they're coming from real manufacturers, aren't what they say they are. In other words, if say it's vitamin C 1,000 milligrams, it may be vitamin C 200 milligrams. And how much more legit and how much more reliable is the stuff that you get at your drugstore that's made by an American manufacturer than what you buy online that came from China. So that's my indictment of the supplement vitamin industry for the week.
Folks, we're at Sycamore Crossing today, downtown Blue Ridge, and like I said earlier when we started the show, be ready. You're going to see people walking. It's a small town America starting out, walking their dogs, delivery trucks, maybe some construction. The bell in the background was the train. So it's so great to be outside. We have Ask the Doc. You can ask a question, info at fetchernews.com, and put in the subject line Ask the Doc. Also, thank you, Georgia Cancer Specialist, affiliated with Northside Hospital. I want to make a note because every guest that comes, I want to make sure you know we're going to be at Sycamore all summer, okay? But we're going to take a little road trip next week because we're outdoor furniture. So we're going to head 1 week over to Rhapsody Outdoor Living for 1 week and go over there and check out the outdoor furniture over there. Sit in some stuff.
You're going to send me a Google map, right?
I am, and I'm looking for an outdoor bed. I'll explain later.
Hey, I didn't get on the soapbox or talk about immunizations today.
All right, so the sun is shining, and now something I remember from Sycamore Crossing, we got to do some adjustments to get the camera out of the sun. But I'm your host, BKP. We're going to be back with the All-Star panel. But before we do, I want to introduce you to somebody new that's just joined the team at FYNTV.com, Team FYN Sports. We want to do that. So get ready. Going to meet a new member of the team, and then it will be time for the All-Star political panel.
See how the sun's shining on me?
Take a break.